This next program is on a product called the Fusion. It's a rigid lumbosacral orthosis that not only offers anterior, posterior control, flexion, extension, but it will also help manage the lateral bending or the frontal plane. So the system involves this soft support, and built into here is a rigid anterior panel. The first thing we'll do is try and shape it a little bit. It's going to come pretty flat, so that may not be comfortable on the tummy. So we just try and shape that a little bit. If we bend it just by hand, it will remember that shape. We bend it past what we need to do, and it'll bend back a little bit, about that little bending. Now you can see it's a little bit of a contour, so it'll fit over the tummy a little bit more comfortably. So that goes back in here, like so. And then we have some options on the posterior panel. Here's the big panel, and as you can see, this is going to shape around the patient and provide lateral support, and we definitely want to pre-shape these also. So I'm just going to bend this over my knee a little bit and get it pre-shaped, like so, and do both sides. And each patient is going to be a little bit different, so we don't want to pre-shape this in the factory. And besides, that would take up more shelf space and your storage, and you wouldn't be happy about that. So just take the time to pre-shape it a little bit, and we're going to actually see what this is going to look like a little bit. So if I could have you turn around, and it's going to fit here, in that general area, and conform around to her lateral aspect. That's still a little bit too straight, so I'll add just a little bit more flex to it, like so, and shape those a little bit more aggressively. And again, this is definitely worth doing for patient compliance, patient comfort, and it also increases the level of support of the device. So that looks much better. You can see that with a little bit of compressive support, this is going to wrap around the patient very nicely. So we can put this back on. By the way, they're labeled bottom and top. All core products have their label on the top, so we know this is the top. It's going to go on like this, and we just align this. There are 3 strips here. Just align it to the center strip and touch the Velcro down in the middle. And so the posterior panel is attached. As one of the options for a step-down brace, this brace also comes with a much smaller pad. So when you don't need the lateral support anymore, you don't need all that rigid control, you can take this out, and let me do that, and put this one in. This one can go either vertically like this, just touch it in, and it'll help maintain the spine. If for whatever reason you want a little bit of extra curve built into the spine, a little bit of extra lordosis, or you want to maintain that curve, you can put this in horizontally, and it'll help that posture. So that would be a step down. You'd start with this and use this as a step down, and then take out the anterior panel. So again, you're actually dealing with 4 levels of support, all built into one brace. So we'll start out with maximum support. This goes on the bottom, get that aligned, like so and so. Touch that down in the middle. And now, in any orthotic device, we want to start with the brace as large as possible. So here are the cinch straps. As opposed to fitting it with the cinch straps extended like this, make sure the cinch straps are put to the posterior, because then the brace is as long as it can get, and then we can use the cinch straps to bring the support into the patient. So these are positioned correctly. So we'll just start with this to the posterior. If we could see you from the back. This starts here, and we want it centered on her spine, obviously, with the support at about the level of the distal margin of her sacrum. You do want to make sure that there's some clearance between the top of a rigid support like this and the inferior angle of the scapula. You would not want her to retract her scapula and hit the top of the support. So make sure there's an inch and a half, 2 inches of space there would be pretty important. Then if I could have you turn around. There's a thumb loop, and I'm going to ask the patient to do this. There's a thumb loop in one panel and a pocket in the other. So just put your hand in the pocket, your thumb loop there, and go ahead and do a crossover closure. pulling it out and just touching that down. Yep, that's excellent. That's great. That's perfect. Excellent. And in the process, teaching the patient at what height this should come. The bottom of the support should come just to the level of her symphysis pubis, and that appears to be the right height. Having it low enough will usually ensure that when the patient sits down, that the top edge of the device won't impinge into soft tissue, which would obviously be pretty uncomfortable. So now it's fit in the right location. Now this has two tabs on each side. So teach the patient how to apply compressive support using the bottom straps first. So she could pull that one out and that one and pull them away from your body. Yep, and then touch them down. They can overlap, is fine. However that turns out, that's great. And then the top two will be second. And she has some hip developments. You see there's more overlap here than here because her hips are wider than her waist, and that would be normal. And so it looks like we have clearance here. We have the right position here, if I can turn you around. We're still square on her spine. Yep, we're still square on the spine. It's shifted a little bit, hasn't it? It's off just a little bit to a side. So we can address that when we do the retraining. But we're at relatively the right height. At this stage, I have one little correction to make sure it's square on her trunk. But now I want to already do some a test to make sure that it's at the right height. If I could ask you to sit down, please. And with the rigid panel in the front there, it's especially important that this come to the level of the groin, but not jab into the groin. And this appears to be just right. There's the bottom of the device. It's right at that level. If it were fit too low, it would jam into there and cause some discomfort. If it's fit too high, it can't support the spine as well, and you'd have the potential for impinging on soft tissue at the top of the brace. So that's exactly the right spot that it should be. So that's excellent. So let's go ahead and have you stand up. So the patient needs to know how to get out of this. When they remove the device, they should always remove the top compression support first and then the bottom straps. So take these top straps. And if you would, try and touch the Velcro down back here on the side, on both sides, yep. And then the bottom straps, and they should also be touched down. There you go. And go ahead and release that. Excellent. And she's now out of her device. If she puts the device down, the Velcro in the front should always touch something. So the rule is you always want to teach the patient how to manage the Velcro, or the Velcro will manage them. Yeah, right. So now she's going to try and put it back on for us and prove to us that she knows how to do that. So she'll get the posterior panel centered, and how she can do that on this device is it has a rigid panel here. Does the rigid panel come to the same spot on both sides, or is it rotated to the front on one side and to the back on the other? So she can palpate that, she can feel that. So from that point, do your closure. Again, thumb on one side and pocket on the other. Simple crossover closure, that looks great. And make sure it's at the right height, and that appears to be great. Then apply compression from the bottom up, and pulling out and touching down. And then the top. And that is a lot of support that's going to provide not only compressive support, but also control anterior posterior bending and lateral bending. From this point, the patient can wear this for however many days or weeks, and perhaps the first piece that would come out is that anterior panel could come out to step down a notch. Then a few more weeks perhaps, and then the large posterior panel could come out, and the smaller one could be used. And finally, she would be left with just the support to be worn prophylactically or during periods of high activity once her back pain is resolved. So it's really 4 braces in one. Fairly easy to fit, but very important to shape that plastic before you fit to the patient. How's it feel?
Good.
Excellent.